How often should you check your blood pressure at home? Guys, I'm Dr. Jen. It's good to see you. I'm going to start off by telling you what I do with my own patients. All right, usually I'm telling my own patients to check their blood pressure 2 to 3 times per week. Every now and then I'm telling them to check it every single day. But either way, I want them to check their blood pressure at least 2 times, at the sitting, separated by 1 to 2 minutes, okay? Because you want to average the numbers, at least know kind of what an average is, all right? So that's usually what I do. A cardiologist that I refer a lot of my patients to, he recommends that his patients check, 2 to 3 times a week or every day, depending on what's going on, but he'll have them check in each arm, okay? So at least twice in each arm, which I think is actually a really good idea, separated by 1 to 2 minutes of your checking your blood pressure, all right? Now, there's a medical source that us doctors use a lot called Up to Date, and they recommend for the diagnosis of high blood pressure to check your blood pressure up to even 2 times per day, every single day for 7 days. That's like 28 times to check your blood pressure. Let me tell you what one of my concerns is about when my patients check their blood pressure at home. And by the way, there is a right and a wrong way to check your blood pressure, okay? There are good monitors versus not so good monitors. A website you should check out is validatebp.org. I have an article about that. I'll try to link that here if you're watching on YouTube. Also, make sure your feet are flat on the floor. You've emptied your bladder before you start checking your blood pressure. You've been resting comfortably for at least 5 minutes. Your cuff is the right size. I have videos on all of these things. It's a video playlist on YouTube, so I'll make sure I connect that here. If you're watching on Facebook and you don't see it, ask me for it. But the other thing that I really want you to understand, though, is taking these numbers into your doctor is going to be very important. Make sure you document this information, bring it in, and also bring in your home blood pressure monitor to your doctor so that they can double check and make sure that this monitor or whatever monitor you have is actually accurate, because not all of them are accurate, all right? Now, let me tell you about one of the concerns I have about sometimes when my patients are checking their blood pressure at home. When I'm having my patients check their blood pressure, it's because they already have high blood pressure, or I'm concerned that they have high blood pressure, or I'm changing their dosing or medications, right? So there's certainly something going on. And often what I've found is my patients, the more I ask them to check their blood pressure, or the more they check it rather, sometimes the more anxious they get. And that can actually raise the blood pressure. And write in the comments, by the way, if you've ever had this happen to you, where you're checking your blood pressure and then you go to do it again. If you do it multiple times over and over again, sometimes that pressure just rises and rises. Similarly, I've had patients who get so nervous to even check it, like let's say they know they're going to check their blood pressure, 7 p.m. They get so nervous leading up to them that up to that time that the blood pressure reading that they get is not accurate. Okay, so I want you to be very mindful of that. And if you feel like that's happening to you, you got to talk to your doctor, because, if you're very anxious, I've often adjusted how often my patients check their blood pressure based on how they're feeling. Anxiety does not help the situation. The other thing I would say too is whenever you check your blood pressure, okay, or however much you check your blood pressure, 2 to 3 times per week, every day, whatever, make sure you're checking at the same time of day. All right, that's really helpful as well. So again, get at least 2 readings, separate by at least 1 to 2 minutes, and then check out my video playlist on high blood pressure. Subscribe to my YouTube channel if you haven't already. Follow me on Facebook. I'm Dr. Jen Caudle, practicing family physician, on-air health expert. I'm on Threads, Instagram, TikTok, LinkedIn, WhatsApp, all the stuff. Please follow me there. Sign up for my free health newsletter at drjencaudle.com.